welcome to the Nursing School Chronicles. We'll be talking about the Skills Lab Confessions, where nursing students spill the tea on the funniest, most humbling, and most surprising lessons learned in the lab and clinicals. All right, so my name is Ben.
My name's Delia. I'm Kylie.
And I'm Catherine.
So I guess I'll start. The funniest experience that I've had in a clinical setting was whenever I was taking care of a patient, and he was staring at me. He was like that, right? And you could tell something was not right. And he said, dang, you have a ferret on your head, like a ferret. And I was like, okay, right? And he was like, nah, you should be happy about that. You have a full head of hair and all that. And I was like, okay, he's a little jealous.
Imagine if he would have saw your long hair.
Yeah.
Oh my God.
Long hair. And the most humbling experience was I was at the ER and I needed to start an IV. And the IV before, I messed up, I'll be honest.
Yeah.
So I was a little nervous and I was shaking and all that. And I was putting on my glove and I was my hands sweat like crazy.
Yeah.
So I was putting it on and I went, and it ripped. And the nurse was all like, all right, you're done. Go over there. And I was like, oh, So that was the most humbling experience, I would say.
What about the one where you you were trying to do an IV again?
Yeah.
And the same thing happened to him. He was trying to put his glove on. He grabbed two different sets of gloves. And each one popped. And the nurse so annoyed. She just completely ignored him and just ended up doing the IV. And
that happened to me. That's the most humbling experience, I'd say.
You start putting baby powder on your hand.
Yeah. Or Carpe or something. Something sweat.
Man, for me, one of the most memorable but humbling experiences was getting to observe an epidural. I really thought being in that setting I would be able to watch it and not freak out or anything, especially because I was oh, I know what this process is, especially since we go over all that kind of stuff all the time. And then I sat there or I stood there and I was watching, and I just remember him moving the needle up and down, and I was oh my gosh, I think I'm gonna pass out. I was let me sit down somewhere. I was I don't want to scare the patient. I feel so bad right now. Yeah. This is really embarrassing that my ears are getting really hot. And then my funniest is always thinking I know how to do a head to toe assessment before I go into a patient room, and then I immediately choke up. And it's even worse when your nurse is there because you know what to do, but then in the moment you're everything's out the window. I'm so sorry. I'm not capable. I'm falling apart on you. I'm so sorry.
And then they say, you're forgetting something super important.
That's the worst part. My hands start sweating. I'm oh my gosh, did I forget something? And they're you can go back in there. I'm no, it's embarrassing now. I just went in there and told my patient, we're done. But yeah.
My probably is the worst one is whenever I'm listening for heart palpitations, and sometimes I forget what I'm listening for. Yeah. And I hear the heartbeat, but I'm I guess it sounds normal. That's right.
I had my stethoscope on for a head-to-toe assessment, and I was listening to the heart, but so mine's a Liftman, and you have to turn it. I had it on the wrong side, so I couldn't hear anything. I was
you're what the heck?
They're still breathing.
Yeah. With the respiratory, everyone, they expect you to be able to observe their respiratory, and I'll sit there, and I'm counting it, and I'm 1, 2. And then I get so easily distracted that after 3, I'm 4.
Yeah.
And it's already been 30 seconds, and they're oh, how many did you count? And I'm 18. I did not count 18. I did not.
Wait. Oh my gosh. Oh, you know what? Me and Kylie yesterday experienced an incident where we were doing vitals, and we had patients having an O2 of 89 or lower, and in our heads we're yeah, that is concerning. I guess we'll just get back to the nurse once we get back. We weren't this is really urgent, we should probably say something right now. And then it was embarrassing because we both got flush red when our nurse was looking at the chart. She's did you tell anybody? Yeah. Did y'all let anybody know that these patients had low vitals? We're we thought about doing that, but we weren't sure because they were getting off of oxygen.
We put their pulse ox on wrong.
Yeah, and that was
got a 95 when they rechecked.
That's why I was oh my gosh, I know that in paper, but when I see it in person, I'm not even thinking about it, especially when your patient's talking to you all casually. Yeah. Then you're I guess we're not worried.
Do y'all ever think that the pulse ox is supposed to go on a different finger? I know that usually people put it on this one, But sometimes I'd be putting it on this one.
I put it on
like,
any finger my patient will give me. I'm like, what finger do you want to do?
But do you think that it like makes a difference? I don't think so, right?
I don't think it does.
I would hope not, because I've been doing it on different fingers. I just don't do it on the thumb. Yeah.
You all do it on the thumb. You're like, that don't look right.
Oh gosh.
What about you, Kylie?
My most humbling experience is when we did NG tubes in the skills lab, and I was going straight, and I thought I was going down the throat, but it was coming out of his mouth.
Oh no.
Out of the mannequin's mouth. I was like, oh my goodness.
I remember when me and Serena did an NG tube like right before the beginning of the semester started, and we were doing it on the mannequins. But do you guys ever realize how small the mannequins' heads are? Like realistically, nobody's head is that small. So like we were taping it, and this poor dude, he had so much tape in his eye. I was like, dude, if this was a real person, like the amount of tape that I had in this dude's eye. And Serena was like, I don't think it's supposed to go like that. I was like, well, that's how it's going today. And like the tape was like falling off of his ear and everything. I was like, oh no.
Gosh. But I mean, that's what's most intimidating about skills labs, I feel like, too, especially since they're not real. And then like if they blink and breathe, that freaks me out. Yeah. But like one of the things that I was thinking about that was really embarrassing is just learning Foley's, because like especially when we did like a female mannequin, and I was like, oh yeah, this is easy. But then I did it in labor and delivery, and I just kind of got like freaked out, because I was looking at the patient's anatomy, and I'm like, I guess I don't know what I'm doing. I don't want to hurt this person. Let my nurse step in. And then it's more embarrassing when you don't get to do it, and then they're like, why didn't you do it? I'm like, honestly, I don't want to hurt somebody. I'd rather you demonstrate first and let me do the next.
And it's so different in person.
Yes, it looks nothing like a mannequin.
I feel like sometimes that's what I wish about like our skills lab more often, that we got to experience, like obviously not the Foleys and catheters, because like, no thank you. But like doing like the I forgot what it's called.
NG tubes.
Like NG tubes and stuff like that. Like in like bigger schools, like people do it on each other. Like we've never done anything on each other other than IVs.
Yeah. Yeah.
I don't know. Okay, I guess I almost passed out in the ER. It was the same day that Ben was doing his IV. And it was just one of those days, y'all. It was just one of those days. And then we had this patient come in with like a huge gash in her hand, like humongous, like this big. And it was so scary. The lady was literally so nice. She was a EMS. Yeah. She was super cool. She was like walking me through everything. And I was like, they made me clean it. And I was... her skin was like flying everywhere, and I was like, I cannot do this. And finally the doctor starts trying to explain. The doctor was great. He was like trying to teach us everything like we could learn, and even though we don't do sutures and stuff, like he was trying to like teach us how to do it. I was standing there watching this man suture this lady's hand, and all I could think about was the fact that this lady had these they're itty bitty little needles, right? But this dude was just like, and I was like staring at it, and I was like, oh my god. I was like, that looks like that hurt. And I kept asking the lady, I'm like, are you okay? Are you okay? Like, you sure you can't feel it? Are you okay? She's like, I'm fine. It's okay. And I just remember, I was like, getting really hot in here. I was like, it's
and you just knocked off.
And I walked away for 2 seconds, and I come back, and Jill was looking at me. She's like, are you okay? And I'm like, no. And I got super lightheaded, and I remember feeling myself kind of like go back, and I was like, is it the blood or is it the sutures? Like, what's going on right now? And Jill was like, girl, smell some alcohol. Like, you're fine. And I was like, dude, no, like, I'm about to pass out in this freaking lady's room right now. Like, I was so embarrassed.
I don't blame you though, because it's like early in the morning, and it's not like we just woke up like 2 hours ago, right? And we were seeing all that stuff. Yeah. Like that's why with the IV, it's like it's 6:45. You know, like it's early, and I'm over, like, you know, like I'm already getting an adrenaline.
Hands are already sweating.
So I'm like, yeah. So it's like, you know.
Yeah, it was so bad. So that's kind of what makes me not want to be in the ER sometimes, because I'm like this isn't going to be the only thing. Like, this is nothing compared to some of the stuff that I'm going to end up seeing if I do the ER.
Yeah.
But I just cannot. I was like, dude, like the fact that you could literally like peel back this lady's skin, I was like, oh my god.
Well, yeah, and then the cleaning was rough.
Yeah, that was
glass and stuff.
Oh no.
Goodness. I was scared.
So you had to like
0 out of 10. 0 out of 10. I never want to feel that way again. And I was so embarrassed, because even the doctor was like, oh, like, it's fine, like, at least you have empathy. And I was like,
yeah, but he saw you walk off, and he was all like, whenever she comes back, you need to talk to her.
I was like, oh my god, I cannot do this. Never again.
I think that's why I'm intimidated by OR. I don't think I can sit there and watch them work inside somebody, because it's not that I'm like squeamish, but like I'm imagining that's me on the table, and I'm like, oh gosh, that looks painful, and I know that's gonna hurt after in their recovery phase. I don't think I can do it. I'm not tough enough.
I just don't want to see my body. Like, I know that the human body is disgusting. I know it is.
I don't want to know what's in the inside.
I get so freaked out. Like, whenever we're like, I remember in biology, like when we would like do like little skin samples, and I was like, ew, that's crawling. I was like, no, super bad.
I'm weird. I actually like enjoy
Yeah.
that stuff. It's
I
you
like
like
the
you give up.
microbiology class we had. That was cool, but you know. And then I try to make anatomy fun. I named mine like a dissected cat Pickles because he was pickled. So yeah,
That's really funny.
I try to make light of it so it wouldn't freak me out as much.
yeah.
Because then how do you explain to your family when you have like pictures of like a dead animal that's opened up and everything, and then on top of that, like your anatomy, like mannequins that are just body parts and stuff, and like, oh, that's just for study, you know? We're
Yeah.
not a weirdo.
Those museums. Oh, all right. So thank y'all for listening to the podcast, and we hope to see you all again or talk to y'all again. All right. Thank you.
Thank you.
Peace out, Girl Scout.